Good afternoon, everyone. You are very welcome to the SunSmart for Post-Primary Schools webinar. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using any other device, you will find this feature located at the top of your screen or where the three-button feature is. Now, without further ado, I will hand you over to your host for today, Maria McNiry, Cancer Prevention Officer and National Skin Cancer Prevention Plan Coordinator. Thank you.
Thanks, Jean. So welcome everybody. So today's webinar is on how to become a SunSmart school for post-primary schools, and it's organised by ourselves in the HSE's National Cancer Control Programme. So we have a number of speakers today, including Kelsey O'Donnell, who's a skin cancer clinical nurse specialist at the Mater University Hospital. She'll be kind of talking through the importance of sun protection for children and adolescents. I'll then be coming on to give you an overview of the SunSmart School Toolkit and kind of walk through the materials that are available. We then have Bernie Carter, who is Assistant Director of Nursing at the Marie Keating Foundation. So she's going to be providing an overview of the Marie Keating Foundation Schools Cancer Awareness Programme. We then have a case study from Elaine Murphy, who's a teacher at Castleline Community College, and the students there on their SunSmarties project. Following that, we have an interactive engagement. So just asking some questions on Mentimeter for you all. And then lastly, we'll have a Q&A. So that'll be an opportunity for you to ask any questions to our panel here today. So we do hope you do enjoy today's webinar. It is being recorded, so a link will be sent out following today's webinar so you can watch back and circulate to colleagues. Unfortunately, we cannot answer any individual medical questions, but if you do have any comments or questions related to any of the discussion today, please do pop them into the Q&A function, and we will try and answer them at the end of today's webinar during the panel discussion. Otherwise, one of our team members will respond directly to your response. And then we will be providing links and resources as well as contact details following today's webinar. So I'm just going to hand you over now to Kelsey O'Donnell. So as I said, she's a skin cancer clinical nurse specialist at the Mater University Hospital. So she has a decade of experience across dermatology and skin cancer services. She holds a master's in clinical dermatology and is currently completing a master's in advanced practice. So with a strong clinical and research interest in melanoma, she has led and contributed to national work in skin cancer prevention, education and service development through the NCCP, including her role as co-founder and chair of the NCCP Skin Cancer Clinical Nurse Group. So Kelsey is committed to advancing melanoma care and promoting SunSmart awareness in schools and communities. So I'll hand you over to Kelsey now. Thanks.
Thanks so much. I'm just going to share my screen. Now, hello everyone, and thank you, Maria, for your introduction. So my name is Kelsey. I am a skin cancer clinical nurse specialist in the Mater Hospital in Dublin. I've been working in the area of skin cancer for the last 8 years. And I think it's really important that to talk to you today about why sun protection and awareness of the risks of UV exposure is so important in the area of adolescents and children, and particularly in the part that schools can play in helping deliver this message also. So before we start, I'd like you to think back of your own teenage years. Have you ever been sunburned as a teenager or as a child? Did you or yourself, or did you know someone who used sunbeds back in the day? And did anyone ever teach you about the UV risks at school? So if we think back to our own teenage years, we all know someone who's done a sunbed. We can all probably remember a sunburn ourselves. But we were not really were we really educated back then on the risks of UV exposure? So it's kind of to stop for a second and just think of our own experience before we head into thinking about how we can educate others. So a little bit about skin cancer in Ireland. It's the most common cancer in Ireland, and there's roughly about 11,000 skin cancers diagnosed annually. Melanoma rates are rising in young adults, and melanoma is a form of skin cancer that we would take most seriously. It's the most common cancer in the age group of 15 to 4-year-olds, and 90% of these types of skin cancers are caused by a UV exposure. So what is a skin cancer? So skin cancer occurs when DNA damage into skin cells causes them to grow uncontrollably. And the majority of these are caused by an ultraviolet light, which can be a natural, which is sun, or can be artificial, such as sunbed use. So just on the Irish landscape, we have about 11,000 skin cancers diagnosed altogether. There's different types of skin cancers, non-melanoma and melanoma type. And there's projected that by the year 2045, we will nearly have increased our skin cancer numbers by over 300% in Ireland. And this is for the non-melanoma skin cancer group. And for the melanoma skin cancer, we would predict that there's going to be a significant rise. So what we'd have at the moment is about over 1,000 cases per year. This will increase by up to 3,000 cases per year, which is a significant increase. So just to keep that in the back of your mind, that there's the projected increase over the next few years. So what is UV radiation? So ultraviolet UV radiation is a form of energy from the sun that is invisible to the human eye. And different sources include the sun, artificial sources such as sunbeds, tanning beds, and other artificial light sources that are available. So as we can see, UV from the sun is split into 3 different types. So there's UVA, and this is the type of UV radiation that penetrates quite deeply, and this causes skin aging over time. UVB is more superficial, and this causes sunburn and direct DNA damage. And UVC is usually absorbed by the atmosphere before it reaches humans on Earth. Combined UVA and UVB both contribute to development of skin cancer. So how does this affect on humans? There is benefits to UV exposure. It helps the body produce vitamin D, but the risks are far more significant than the benefits. The risks include skin cancer, skin aging, sunburn, and also eye damage. So in the group of adolescents, which is what we're focusing on today, these are considered a high risk group when it comes to UV exposure. Teenagers are often spend long hours outdoors during sports or social activities, and at the same time can take risk-taking behaviours such as tanning or using sunbed use. There's also an emphasis then on peer influence, which can be much stronger sometimes than parental influence. And teenagers can often have a low awareness of the long-term risks of UV exposure. In childhood, UV exposure in childhood is quite significant in the long term. The first 10 to 15 years of a child's life are critical for sun exposure. A severe sunburn in a childhood significantly increases the risk of melanoma. And more than 3 sunburns before the age of 50 can give, or age of 20 can give you a 2 to 4 time increase of having a melanoma later on in life. Sunbeds, why are we so concerned about them? There is a link to sunbeds and skin cancer risk, and this has been well documented in clinical evidence. So sunbeds emit intense UVA and UVB radiation, which can sometimes not be regulated. It is classified as a carcinogen to humans by the World Health Organization and the the International Cancer Societies. The first use before the age of 35 increases a melanoma risk by 75%. So just to note, there is no such thing as a safe tan. And sunbeds in Ireland, there has been a lot of work around the legislation and protection. It is against the law to allow a person under the age of 18 to use a sunbed. It is also illegal to sell or hire a sunbed to persons under the age of 18. And it is known that there isn't a direct link between sunbed use and increased risk of melanoma. I'm not sure if some of you are aware, but there's further work being done in the background on a ban of sunbed use in Ireland, which we, from a skin cancer point of view, we would warmly welcome. So just some sunbed myths. I'm sure you've all heard one of these at some stage. So getting a base tan from sunbeds before going on holidays. Sunbed tanning is safer than sun tanning. People would say a suntan makes them feel healthier and more attractive. And people think that if they do sunbeds before, they won't get sunburnt on holidays. And some people think that it's a good way to get vitamin D. However, as for people who think that having a base tan before going away, a tan only provides perfection equivalent to using an SPF of 3%. So a Healthy Ireland survey back in 2019 on sunbed use in Ireland showed that 3% of the Irish population have used the sunbed. It's higher amongst women and it's higher in urban areas, particularly in Dublin, and higher use in economically deprived areas also. As we can see, this was a study done in 2020 of the registered sunbed premises in Ireland. And as you can see, the more urban areas are more heavily populated. So we've Dublin, Cork being the highest, Limerick following suit. So there was 424 registered sunbed premises back in 2020. The different types that these were distributed among were, majority of them were beauty salons. There was some in hairdressers, standalone commercial units, and gym use, leisure centres, and in grand total, there was 413 there across different types of business types. So how can we be sun smart? So Maria will be speaking to you about all the SunSmart codes, but the main one to remember is the 5 S's. So slip on clothing, slap on sunscreen, slap on a wide brimmed hat, seek shade, and slide on sunglasses. And these are the 5 S's which we would recommend to help skin cancer prevention. So we talk about slapping on our sunscreen, but what is sunscreen and what is an SPF? So an SPF is a sun protective factor, and sunscreen can be quite daunting when you're looking at them in the shops or pharmacies or supermarkets. And the easiest way to break it down, so an SPF is a UVB protection. So as we remember, the UVB is more shallow, so that'll give you more of a superficial cover. And these typically range you'll see numbers on them from a 2 to a 50 plus. A UVA protection, which you'll see sometimes at the bottom of a bottle of sunscreen, will have either UVA or it will have a star rating, which will be from 0 to 5 stars. And that's your UVA protection. So we usually recommend an SPF, so the UVB protective factor of 30 plus for adults and a 50 plus for children. And in general, we always try to recommend people to pick up sunscreen that is a UVA and a UVB, which is called a broad spectrum SPF. So this will have your SPF 50 on the bottle or 30, and then a UVA logo at the bottom or the 4 to 5 stars. So the sunscreen bottle on the right would be a broad spectrum, which would have the SPF 50, which is the UVB protection, and then the bottom would be the UVA protection. So no sunscreen can provide 100% UV protection, and we always recommend a sunscreen to be used in combination with other sun protection measures. We generally recommend to apply sunscreen 20 minutes before exposure so that it's able to settle in, and we recommend to reapply every 2 hours. And also to reapply after any activities such as swimming, toweling, or if people were to be quite active and were sweating profusely, we'd recommend to reapply their sunscreen. And just to note that sunscreen does expire, so your bottle from last year may not still be in date, so it's checking your label, which will tell you how many months after opening that would be viable for. So it's very important to know that sunscreen does expire, and to keep that in mind as well. Another thing we really honed in on in the last couple of years is educating people on the UV index. And you might have heard this on the radio, and especially during the summer at the weather report, it will tell you what the UV index is for the day. And also on the weather report on the television as well, it'll tell you what the UV index. So what is the UV index? It's a scale from 1 to 11 plus. And on that scale, it gives a number. And the higher the number, the higher the risk of having UV damage on that day if you were to be out and exposed. So from anything from a 3 and above, you will have sun damage if you were to be out and not using any sun protective factors, such as clothing or sunscreen or covering up. In Ireland, we can manage to get a high UV index, surprisingly, even during the summer. And it's good for people to know what the UV index is before going out. A good tip is that on your phone, on the weather app, if you go into your weather app and go down to the bottom, you're able to see what the UV index is for today. So the main point to get across is that if 90% of skin cancers are caused by a UV source, then 90% of skin cancers are preventable. And by educating teenagers, adolescents today, schools have a vital role in and a really important opportunity to prevent cancers that might otherwise appear in the latter years, 20 for 30 years from now. So if there's any questions, I'm happy to take questions, or if we want to wait till we will have opportunity at the end to do a Q&A, and I'll hand you back to Maria. So thank you.
Okay, I'm just going to share my slides now, as I'm just going to give you an overview of the SunSmart School Accreditation Toolkit, as well as other resources and practical examples, just to help you if you are deciding to become a SunSmart school or just want to know more about the whole process. So I'll just make this full screen. So yeah, it just walk through the materials and practical ideas for the classroom, and also include the curriculum links. So how it links in with, you can link in with science, SPHE, the wellbeing framework, curriculum, policy and planning, relationships and culture. So I suppose the toolkit was launched last year. So it was a soft launch last year, and I suppose we're doing a bigger push for it this year. and the toolkit provides your school with information, resources and supports to become an accredited SunSmart school. So I suppose the toolkit includes everything that you need. So it has a step-by-step process on what's involved to become a SunSmart school. It also gives practical examples, so it provides case studies of schools who have done SunSmart projects. So whether that's the BT Young Scientist exhibition or the Young Social Innovators. And I know Elaine from Castellana Community College will be talking about their case study later on in today's webinar. And then there is links to further supports and resources as well. So I suppose the first step we would recommend is to either download or order the SunSmart School Toolkit. So it is available on helppromotion.ie. We will send around the direct link to where you can download or order it following today's webinar. But we do have a number of hard copies available. So we have limited stock hard copies available every year, but every year we would restock. So if you realise that we don't have hard copies left, you can still download them and print them. But we would recommend to order hard copies while they're available. So then I know a lot of people might be wondering how the toolkit supports the school's wellbeing framework. So the SunSmart School Toolkit for post-primary schools has been developed to help schools to recognise the importance of promoting sun safety practices in the whole school environment. The toolkit links with the Department of Education's wellbeing policy statement and framework for practice, where wellbeing promotion is at the core of the ethos of every school and centre for education. So we do link in with the Department of Education every year, just about the SunSmart School accreditation, resources available, any webinars we're running. So I know the Department of Education sent out a letter to all principals in all post-primary schools last week. So that gave details of this webinar about the SunSmart School accreditation and other resources and supports available, and why it's so important to, I suppose, raise awareness of sun protection and the danger of sunbeds in schools. So I suppose just to give you some information, I suppose why should your school become a SunSmart school and why it's so important. So skin cancer is the most common cancer in Ireland, and the number of people being diagnosed with skin cancer is rising rapidly. So just over 11,000 cases diagnosed every year, and the National Cancer Registry of Ireland has shown that between 2015 and 2045, the projections for skin cancer is due to more than double. So I suppose we know that people spend a lot of time outdoors. People are more likely to go abroad on sun holidays, and then I suppose as well as that, in Ireland, majority of people would have fair skin types. That's Fitzpatrick skin type 1 or 2. So we're more susceptible to burning and more at risk of UV damage. So there is a number of reasons why in Ireland the rates are going up year on year. We know that children and young people's skin is very sensitive to UV from the sun and also sunbeds, which can cause long-term damage. So UV exposure during the first 10 to 15 years of life makes a disproportionately larger contribution to developing skin cancer as an adult. So there is a National Skin Cancer Prevention Plan, which was written by ourselves in the HSE's National Cancer Control Programme and the Department of Health. So there is a number of specific at-risk groups we specifically target as part of the plan. And children are specifically named out, as well as adolescents and young people, because their exposure to UV during early life massively contributes to developing skin cancer late in life. And I suppose with melanoma skin cancer, that's the most dangerous form of cancer, and of skin cancer, and we do know that it can happen, that people can get melanoma in their 30s, 40s, 50s. So it is really, really important for young people to protect their skin, not get sunburned from a young age, because all of the damage that you get is cumulative. So it builds up every time you get the damage, and that can contribute to developing skin cancer later in life, which is why we are working with schools to implement and to encourage sun protection behaviours and to highlight why it's so important to protect your skin. School hours fall within peak UV periods of the day, so generally between the 11 a.m. to 3 p.m. is when the UV index can be 3 or above. Now, we have always said it is between April to September, but Met-Air and data is showing now that from data from the last 25 years that it's actually, the UV index can be 3 or above from around St. Patrick's Day, so mid-March up to the first week of October. So even though it might look cloudy outside, you're still getting the UV damage. So if the UV index is 3 or above, you can still get damage to your skin. So schools can help protect children's skin, reducing risk of future skin cancers through education and role modeling. So I suppose there is opportunity there to kind of highlight why it's so important. So I'm going to talk through the step-by-step guide. So this gives all of the 4 steps. So the first one is to plan and commit. So first of all is to communicate your plans for accreditation. So the very starting point is to decide, does your school want to become a SunSmart School accredited school? Then identify who will become part of the working group. So will you have students, staff, principal involved? We have a checklist in the toolkit which you can review current practices. So it's kind of like an audit to see, okay, where we're at the moment, what are we currently doing in the school, what areas can we improve in, what ways can we look at implementing more SunSmart practices. Then step 2 is develop a SunSmart charter. So we have a template included in the toolkit as well. So schools can literally just put in the school name and then get it signed by the school to make sure everyone's happy with it. Or if you want, you can adapt it. You can take out bits and pieces of what you want to include in the charter. So there is one available. I know some schools might have their own one that they want to develop, but there is one available. And then once the charter has been agreed with the school, so you would display it in the school and or online to get buy-in from the whole school community. Step 3 is to implement SunSmart practices. So we have a number of suggested strategies that we include in the toolkit, which I'll go through in a minute. I'm not including all of them. It's just some examples that we would recommend. But some of them would include the SunSmart lesson plans. So within the HSC Making Healthy Choices too, there is a sun protection module in it. So that's for junior cycles. We would encourage schools to use that. There is currently another resource being developed for senior cycle, which we are including sun protection sunbeds. Now that's not available probably till the next year, but it will be made available. And then also simple things that you can do in the school, like put up SunSmart posters about the dangers of sunbed use, provide relevant resources to parents and guardians. We do have a sample letter for parents and guardians as well, just on the importance of sun protection for children and why you're applying for the accreditation. So that's a sample letter the schools can also use. And then I suppose next is to decide what actions your school plan to implement. Also really important to ensure an evaluation process is included as part of it, so to kind of review your practices and what you're doing. So these are just some examples. Again, we have left space in the toolkit for schools to add others. So if there's something maybe that doesn't quite align with what you're doing, you can put in your own strategies, but these are examples that we've included. So as I said, the UV index is checked daily. So as we said, generally April, September, but the data is now starting to show that it's from middle of March to beginning of October. And that's communicated to the school. So when the UV index is 3 or above, that staff and students are encouraged to kind of check that, take action to look at the data, or have maybe someone in the school to update what the UV index is each day for the school so they know. Then for certain outdoor activities, so excursions, sports days, inter-school sports days, sports events, that you check what the UV index is for that day. And if it's 3 or above, it's really important to include and highlight the importance of the sun protection strategies, which is wearing hat, clothing, shade and sunscreen. And sunglasses as well. Then when we look at shade as another area, an assessment of existing shade would be conducted annually to review the quality and availability of shade. So you might do an audit to see what shade is currently available in the school. Then having a look to see when students and staff are outside, are there any shaded areas for them to sit at if students want to avail of it? Is there no shade available? Would it be worthwhile looking at shade structures available? Where do students generally congregate? So kind of just doing an audit of what's available. And then students and staff will be encouraged to use available shaded areas when outside, especially when the UV index is 3 or above. Then with clothing, so uniforms would encourage covering skin for sun protection, also wide brimmed hats, so looking at long sleeves. And then staff and students are encouraged to wear hats that protect their face, ears and neck where appropriate when outside. Now, I know a lot of people prefer the baseball style caps, which is fine. But if you are wearing a baseball style cap, it's just really, really important to remember that those caps don't cover your ears, back of your neck and parts of your face. And they are places where people are very likely to get sunburnt. So if you are wearing those style of caps, you do need to put on the sunscreen, reapply it regularly, whereas what we recommend is a bucket style or wide brimmed hat, because then you don't have to worry about the reapplication and applying sunscreen. Then when it comes to sunscreen, so students will be encouraged to bring their own sunscreen from home and reapply regularly throughout the school day. The school regularly communicates with parents, reminding them to ensure their children apply sunscreen, so it's SPF 50 plus before coming to school, and then kind of have it with them to reapply. So the recommendation is for adults to wear SPF 30 plus, and anyone under the age of 18 to wear SPF 50 plus. When it comes to education and awareness raising, so communicate information about being SunSmart regularly, so whether it's through whatever communication channels you use, whether it's newsletters, the internet. And the school commits to delivering SunSmart activities as part of SPHT to all junior cycle classes. There's also opportunity in transition year for students to do kind of more work when it comes to sun protection. They might even like to lead on becoming a SunSmart school or other kind of research projects or sciencey projects that they could do in transition year. Then look at different ways sun safety education can be integrated into the curriculum where relevant. When it comes to the school community engagement, so school staff would role model the sun protection behaviours and designate at least one SunSmart champion. So that can be a staff and or student to inform and encourage school-wide SunSmart behaviours. Now, I know that Castletown Community College will be presenting their case study, which they kind of were the initial pilot school to become a SunSmart school. So they'll be able to give kind of some practical examples of what they did in their school, which might be helpful. So as I mentioned, the HSE Making Healthy Choices 2 is available for schools to use, which I'm sure you're already aware of. If you do want this resource, you can request it by emailing prevention@cancercontrol.ie. And then the last step is to apply for the accreditation. So if you feel like you have got 5 strategies fully implemented within the school and you have a charter developed, you can then apply for the accreditation. So you would upload the criteria that you meet via the registration form, which I'll share in a minute, and then a copy of the charter. The SunSmart School Accreditation Steering Group will review the application and then will provide a certificate of accreditation if successful. So as I said, it's the 5 strategies and the SunSmart School Charter, and the application form is available. So the QR code is on screen. We will also send a link to it following today's webinar with all the information on where you can apply, where the form is and the steps on how to do it. Then I suppose with some practical ways that we would suggest for post-primary schools to teach sun protection, we are working with Met Éireann at the moment to develop some short educational videos on the importance of sun protection, and also to give schools some project ideas that they can use within the schools. So we will be sharing them as part of the campaign, the SunSmart campaign, which commences in April time. So we can share those videos to each of you who've attended today's webinar when they are available. Then we also would suggest, as an example of a project, would be to daily UV index displays. So a UV index poster is put on a notice board and have students dedicated each day to update it to check what it is. You can also compare Ireland's UV index to other European countries to build awareness, because sometimes I think we often think in Ireland the UV index probably isn't that high, but you would be surprised that even on cloudy days the UV index can be 3 or above. Another example of a project would be student-led campaigns. So have students design a dangers of sunbed campaign, maybe develop posters or short videos explaining the dangers of artificial tanning. Maybe encourage peer-to-peer education. So students often respond better to messages from their own age group. There is also in the toolkit kind of examples of how the Castle Island Community College applied for the Young Social Innovators Programme, and also other students who applied for the BT Young Scientists and Technology exhibition, which relates to sun protection and our sunbeds. So it's just worth looking at that to kind of get some maybe ideas. As I mentioned, transition year is a really, really good opportunity to use a wide range of teaching and learning methods when it comes to sun protection. So the SunSmart Toolkit, I suppose, is an ideal transition year project. So it will provide a range of skills, which includes research, interviews, classroom discussion, practical work, and also guest speakers. So I'm just going to quickly run through some resources and more information. So as I mentioned, we do have our annual SunSmart campaign, which runs from April to September every year. So it's run by ourselves and the HSC's National Cancer Control Programme and Healthy Ireland to increase awareness of steps you can take to protect your skin from the sun and reduce your risk of skin cancer. We also have a Dangers of Sunbed Awareness campaign, which runs right throughout the year. So when we're sending information following today's webinar, we can send you the partner pack for the Dangers of Sunbed Awareness campaign. The partner pack for the SunSmart campaign will be launching the end of March because the campaign starts 1st of April. So we can send that on when that's available. We have a wide range of posters, leaflets and resources available to download, or you can order hard copies free of charge from healthpromotion.ie. Again, we'll send a link on where you can order or download these. I've just given some examples of posters and a leaflet that we have available. And these were specifically written and developed for adolescents and young people. We also have a wide range of SunSmart videos available on the NCCP YouTube channel, which debunk myths relating to skin cancer and sunbeds. So we have worked with dermatologists over the years who've recorded short videos debunking some myths. Like examples would include, is it safe to get a tan? Are the chemicals in sunscreen dangerous? Why is it so important to protect your skin? Like there's a lot of questions and a lot of, I suppose, myths that we see on TikTok and Snapchat. So the dermatologists have recorded videos to kind of debunk these myths. These might be good short videos to share with students in the classroom when you're doing any educational pieces with them. And as I said, we are working with Med Éireann to record some short videos for this year's campaign, which we can share when they are developed and completed. I won't go through the Marie Keating Foundation Schools Cancer Awareness Programme because I know we have Bernie Carter here today to go through that in detail. And then just lastly, we do have support available for you as a teacher and the school. If you are considering becoming a SunSmart school, you might find it a bit overwhelming. You're not sure where to start. You might have some questions. So we do have regional, so senior health promotion improvement officers in cancer prevention in each of the HSC health regions. So all of their contact details are available in the toolkit resource, which we will also send around to everyone following today's webinar. If you can find someone in your area, you can contact prevention@cancercontrol.ie and we can direct you to the relevant person. And then I've just linked in here my email address and our website where you can get more information. So I'm just going to stop sharing now. And as I said, we will be answering questions. So if you have any questions, you can pop them into the chat and we will have time at the very end for Q&A. Thanks. So now I'm just going to introduce Bernie Carter. So Bernie is the Assistant Director of Nursing for the Marie Keating Foundation and Manager of the Schools Cancer Awareness Programme. She also manages several other programs, including the BRCA Genetic Services, Comfort Fund Services, and Corporate Wellness Services. Bernie's responsible for the design and update of a series of cancer awareness presentations and leaflets on the most common cancer types and on cancer prevention. She's over 25 years experience working in oncology in Ireland, the UK, Australia, and Canada. And then she also has a master's from Trinity College Dublin with a master's thesis in oncology. So she's presented in cancer awareness for over 25 years and is passionate about empowering individuals with the knowledge to care for their own health, which in turn will help decrease the rates of cancer diagnosis or help diagnose cancer at an earlier stage. So prevention is ideally the best, but if cancer is diagnosed at an earlier stage, the outcome is generally going to be better. So I'm now going to hand you over to Bernie, who will give you an overview of the Marie Keating Foundation Schools Cancer Awareness Programme.
Thank you so much, Maria. And hello, everyone. I'm delighted to be here. And I should have told Maria to keep that very short. I think it's not all about me. But no, I am thrilled to be here and to support, as we really want to do in the Marie Keating Foundation, to support this fantastic NCCP initiative. And hopefully, some of you have heard of us before in the Marie Keating Foundation. So I'm going to talk a little bit about our services. I'm going to talk a little bit about a big bit about our schools program, and also how, if you haven't done so already, how you can avail of our program. I'm sure lots of you know about the Marie Keating Foundation, so I'll keep this very, very brief. It was set up way, way back in honor of the wonderful Marie Keating back in 1998. Marie was scared of doctors, scared of hospitals. She found a change in her breast, and out of fear, she didn't go about it. And actually, she'd one of the most curable forms of breast cancer. And if she had gone and got checked out, she would not have died from this cancer because by the time she did go, it had spread to other parts of the body. So, a big part of our work in the Marie Keating Foundation is providing education and awareness around cancer prevention. Schools Cancer Awareness Program, I'm delighted to be manager of this program. And this is what I will dwell more on. But we do have many free services out there. So, do have a look on our website, mariekeating.ie. We've done loads of work around podcasts as well. And as far as skin cancer is concerned, we have 8 serious podcasts on all things skin cancer, where we have dermatologists, oncologists, we have skin specialist nurses like Elsie, skin specialist nurse myself as well, and a lot of information in there. Wherever you get your podcasts, you can get those podcasts. And just a quick glance, you can see there, I won't go into each of our services, but they are all free. So, if you have somebody maybe going through cancer at the moment, maybe somebody has come out the other side, gone through a cancer journey, or, maybe if somebody's worried about genetics and cancer risk, just pop into our website, mariekeating.ie, give us a call or give us an email, and I can give all those details at the end. So our school cancer awareness program precedes myself, goes way, way back. I started in the Marie Keating in 2017, and the schools cancers program started way back in 2006. So, initially the program was for third, fourth, and fifth year students. And then when I joined in 2017, we extended the program for all secondary school children. So for first up to Leaving Cert. Again, it is a free program. I'm going to talk about how the program was evaluated and evaluated very, very successfully. And really what this program does is to go in and work with the students in your schools and engage students in a way that's not scary, as we say, less frightening and more enlightening, or to do what we can do to take the fear away from cancer, and maybe starting that conversation at a very, very young age, as in the first years. Probably down the line, we will start going into primary schools as well, but engaging with the students, learning from the students ways that they want to learn about cancer without scaring them. So we're delighted as well to receive funding from the HSE every year, so we can recruit nurses who are doing a master's in education in the different universities around Ireland to support us to deliver our school cancers program, cancer awareness program. We reach at least 12,000 students every year. And we plan to grow the program and reach more students because, as I say, I think from what our program shows us, from the feedback we get from schools, and I know that one of our nurses was very instrumental in supporting the first school in Ireland that we'll hear about very soon to become a SunSmart school. So I think it's a very important program. We do go in and present about skin cancer, but we also present about smoking, vaping, maybe HPV vaccination. We will gently introduce topics around lung cancer, breast cancer, cervical, testicular. Primarily, those topics we bring into the senior cycle students. For the first, second years, we tend to keep it very much on cancer prevention, and we do really work with the children and present on how can you protect your skin right now. And we kind of take as we've heard already, a lot of damage can be done to the children's skin at a very, very young age. I would work as a public health nurse one day a week myself, and I see that. But there's no blame game here, and we want to get rid of the stigma. It wasn't always written on the box, and so we just work with the children and go forward, and work with the teachers, of course, and go forward, move forward, and look at what can we all do now to prevent skin cancer in the future. So back in 2022, I think to begin with, we worked with the PhD nursing student in University College Cork to get this program evaluated. And really the evaluation, which was primarily done in the southeast of Ireland, the feedback and the review and the evaluation was so positive, as in the learning from the students from the school's program, that we really then went to the HSE to look at funding to help us, implement this program in more schools in Ireland. And basically what this nurse did, she went in, she gave out questionnaires to the students to begin with, over 900 students, to see what did they know about cancer, about skin cancer, how to protect themselves. Then she delivered our presentation, our Marie Keating Foundation Schools Program presentation, and then she went back and evaluated what they learned, and it was just unbelievable. And like when our nurses go into the schools, they don't go in and kind of stand at the top of the room and kind of preach to the students. They work with the teachers, work with the students, listen to the teachers as to what way they feel their students would learn best. We go into at least 30% of DEIS schools in Ireland, and we work with all different cultures, travelling community, refugees, etc. So we listen to the students, teachers, as to how can we do this best. Has somebody in the school maybe have somebody right now going through cancer, maybe lost somebody to cancer? And, we will be very sensitive, and our nurses will be very sensitive if this is the case, if there is someone in that class in front of them that may have somebody right now going through cancer, be it skin cancer or another cancer type. So it may be that what we might do is divide the students into different groups, maybe give them different posters, infographics, say in this case about skin cancer, and then we'll ask them to feed back to us what they learned, and then we'll fill in the gaps. So we kind of do it in a way as well using visuals. So the nurses will go in and they'll always engage with the teacher in advance to have maybe a little table available that they can display all the visuals around skin cancer. They bring in the sunscreens, the different types. They'll bring in different discs to show the kids, what the sun and the UV damage can do to the skin. But again, all the time, we've learned from doing this for years and years and years, if we go in and scare the life out of the children, we've lost them. So again, we do it in a way that is engaging and, as we say, more enlightening and less frightening. So just to give you a little taster about what is in the presentations. Presentations are updated every year by myself. We work with the HSE, we work with the National Cancer Registry, Healthy Ireland reports, World Health Organization, to make sure that the information in our presentations is evidence-based. So we often work with the children to begin with, like get to know your skin, and they love this, especially when they're doing biology, doing science, or maybe it might be that this might encourage them to do biology and study science. But yeah, so we kind of work with them to begin with getting to know the skin, getting to know the skin you're in, what are the risk factors. This could be done through posters, it could be done through, maybe flip charts, etc. We do go all out and talk about those sunbeds. I would do an awful lot of work with the Marie Keating Foundation, with different communities around Ireland in other areas around skin cancer. And yes, we would really support this initiative to ban sunbeds. I would have ran skin cancer campaigns in Australia, also in Calcutta. I often say I'm so old, I work with Mother Teresa, but way, way back, I would have done lots of work. And I know in Australia, they go all out and in the back of buses. In my day, they would have had no suntan is worth dying for. And especially with sunbeds, we know when Australia banned the sunbeds that their rates of skin cancer, especially melanoma, have started to decrease. So yeah, we do kind of really support this initiative, but then we got to look at the sunbed use in the homes as well. So I'm not going to present again on skin cancer. You have had all this already on Kelsey's and Maria's wonderful presentation, but just to give you a little glimpse of what we kind of go in, maybe show in posters. We go through the ABCDEs. Then we get the kids to tell us if they can remember them. We find different ways to educate them on the UV index. We do, of course, the 5S's, which is fantastic. I'm not promoting little orality here, but we talk about, you know, the different sunscreens. 4 children myself, many kids may be going through or have acne or other skin conditions. So we kind of talk about, you know, the importance of talking to their doctor, to their dermatologist as well, to find the best sunscreen protection for them. So yeah, this is just a little glance to show you, you know, kind of what we do. I did it very fast there. I tend to be in first gear when I start presenting. But yeah, and I know Maria's going to share with you as well, and we're going to have some questions in a moment about how to access our program. I know our nurse Carl in the south of Ireland was delighted to help the first school in Ireland to become a SunSmart school. And our nurses around the country, you know, south, east and west, want to support your schools to become SunSmart schools. Lastly, I will say I have a very young niece who's going through melanoma at the moment, and don't want any child, any teenager, any person to get this skin cancer or any cancer that we can prevent. And we can do that together. So I'll stop talking now.
Thanks very much, Bernie, and I appreciate you going through that. I think it's very informative for everyone to kind of get an overview of what's discussed with students. And as I said, we'll be sending around more information on that. So now I just want to introduce, so Elaine Murphy, a teacher at Castleline Community College, and the students there, they've pre-recorded their presentation for today. So they're showing their case study on the Castleline Community College SunSmarties project. So we'll play that now. Thanks.
Hello everyone, we are the SunSmarties, and the girls started this programme in 2023 with the name of introducing a sun-safe programme in Irish schools, and the girls are just going to offer you an insight, I suppose, into the running of the project and what they've experienced.
Hello, my name is Rachel and we are the SunSmarties. Our project was based on becoming Ireland's first ever SunSmart school and running an awareness campaign about the prevention of skin cancer. We use the Sustainable Development Goal 3, good health and well-being. So by educating young people about being sun smart, we can help reduce the risk of developing skin cancer later in life and contributing to the overall goal of ensuring healthy lives and promoting well-being for all. We were drawn to this project because skin cancer is the most common cancer in Ireland, with over 13,000 new cases diagnosed every year, and this number is expected to double by 2030. This concerned us, and we felt that education about skin cancer at a young age is key for prevention. From our research, we found out how schools in the UK and Australia can register to become sun-safe schools, where the health authorities support schools in creating a sun-safe environment and promoting sun protection behaviours, but we could not find any Irish equivalent.
We contacted the Cancer Prevention section of the HSE and contacted the Senior Health Promotion and Improvement Officer for the South West, Shirley O'Shea. We pitched our idea of designing a sun-safe programme and steps for accreditation for secondary schools in Ireland. She thought this was a fantastic idea and willing to come on board to make our dream a reality, and offered us the opportunity to become a pilot school for running this programme.
We have designed a 4-step programme to becoming recognised as a SunSmart school. Safe 1. Step 1. Developing a Sun Charter, which is a set of guidelines to promote sun safety in school, to which all agree to adhere to. Step 2. Run an awareness campaign. So far, we have displayed the UV index each day in areas that students have access to. We have sunscreen dispensers available for students, individual class lessons, activities and surveys, and displayed the SunSmart 5S's in school. These are slip-on clothing, slop-on sunscreen, slap on a hat, seek shade, and slide-on sunglasses. Step 3. We consulted with parents by sending them surveys to see their attitudes towards sun protection. The final step is liaising with the wider community. We have liaised with local pharmacists and businesses, like Garvey SuperValue, to display our SunSmart messages.
Overall, we really enjoyed getting involved in this initiative, and it gave us many opportunities. For example, we were the overall winners of the Young Social Innovators 2024, and this year we won a Garda Youth Achievement Award for our work.
Okay, so I hope you got a great insight into our project and the experience of the girls, but just maybe one or two other questions maybe that some people might have for you. I suppose, what impact do you hope that this programme will have in the next 5 to 10 years?
We hope to see more schools, including primary schools, get involved as prevention is key at a young age.
And what advice would you give other schools to become involved in a SunSafe program?
I suppose the main one anyway would be to start small. So like if you can just start with before they go outside, make sure they're wearing hats and sun cream. The rest will follow.
And we had a lot of fun, I suppose, along the way, and a lot of
Yeah.
skills were developed, and presentation skills, and really getting, I suppose, the school community and the local community involved. And just very wanted to say, like, I'm so proud of all of your work. And it was just great to be part of it, and your compassion and your enthusiasm throughout it was really, really proud. So yeah, that's everything. Thank you.
Thank you.
Thanks.
Thank you.
So thanks to Elaine and the students who recorded their case study for this webinar today. So I hope you got some good learning from that. And their case study is also included in the SunSmart School Toolkit resource as well. So I just want to move on now. We have just some interactive engagement. So we have a Mentimeter with just some questions we want to ask. So it's basically on how teachers can implement being a SunSmart school in a practical way. And I suppose to get just some feedback from teachers. So I'm just going to share my Mentimeter now. So there is a QR code there. So if you go to menti.com, you can either go to menti.com, scan the QR code, and then there's a code there that you can put in. So I would just ask everyone if they can. Okay, I can see there's people joining. So yeah, I'll just give people a minute or two just to join before I move on to the first question. So I'll just move on, and I think on each slide the code will stay on the screen anyway, so if anyone is just getting their phones out or anything. So the first question we have is, what would encourage your school to apply for SunSmart status? So it's just a free text option. So if you want to add in, it's all anonymous, so don't worry, your name won't pop up. It's just to get some general feedback for ourselves with the SunSmart School accreditation. There's no right or wrong answer either for this. So one person said here, the more resources that are available and how easy it is to implement. Okay, so I suppose in the actual toolkit, we give case studies examples. So we hope that those will kind of give you practical ideas on different ways to implement. And then we have a wide range of resources as well linked in the toolkit. But we are always developing new resources all the time. So for example, we do have the Met-Éireann videos we're developing this year, and that'll continue to grow year on year. So I don't know if anyone else wants to add anything before I move on to the next question. I'll just click to the next slide. So this is what supports would make the biggest difference in helping your school apply. So this is multiple choice. You can select all or one or two. So the options are support from school leadership, sunscreen dispenser boards, portable shade options, UV index signage, staff training, or project ideas for classes. So if people want to vote. Okay, I can see so far there's one for each, which is quite even. If anyone else wants to add, I think 3 people have completed it. If the other people want to complete it. So it looks like the project ideas for classes, the sunscreen dispenser boards, portable shade and support from school leadership are, I suppose, the main things. And I suppose this is good for us to understand going forward, maybe different things we can do and different supports we can provide to schools. As I said, we are developing those videos with Met-Éireann on project ideas for classes to do. So we'll continue to look at that. The next one is, are there barriers to your school becoming a SunSmart school? So the options we put in here is lack of time, not enough shade available, limited buy-in from staff, limited buy-in from parents, difficulty enforcing sun protection, and student resistance. So again, you can select multiple options here for this. So I'll just give people a few seconds to respond. You can see 4 people have responded. Okay, so it's looking like lack of time, difficulty enforcing sun protection are the main things. And we do understand teachers are very, very busy. And I suppose we are trying to engage with a wide range of community organisations and groups. So that would include creches, linking to parents on mychild.ie and different supports in hospitals as well, and community groups. So okay. So yeah, difficulty enforcing sun protection. Again, that's something maybe we can look at exploring how to support that. Okay. Thanks for all your feedback so far. I think we only have 1 or 2 more questions. So which of these feel like easy wins for teaching sun safety? So the options we've put in is posters or visuals on SunSmart, having guest speakers come in, like for example, the Marie Keating Foundation, incorporating SunSmart into the curriculum, staff model sun-safe behaviours, students undertake a project, or use videos and stories about sun safety. So I'll just give people a minute or two. I can see 2 have responded. So if anyone else wants to add their thoughts. Okay, so yeah, posters, visuals, and the use of video stories seem to be the most popular, and that's followed by guest speakers and incorporating SunSmart into the curriculum. Okay, that's really good and beneficial for us to know. Um, the next question is, what creative ideas could help students take ownership of SunSmart habits? Because I suppose when they're in secondary school, you're trying to, I suppose, encourage them to take ownership of their own SunSmart behaviors as well. So the options we've put in here is student designed posters, UV monitoring student teams. That's where they would kind of check what the UV index is, hat design competitions, SunSmart ambassadors, or SunSmart surveys of student behaviors. So people want to put in their suggestions. Okay, so 2 have responded. If anyone else wants to add their suggestions. So the UV monitoring, student designed and hat design competitions. Okay, UV monitoring, student teams, and I think that's something we're working with Mid-Air and just as examples of projects that they can do with the UV monitoring. So we'll be sharing that when it's developed. And the next question is, how likely are you to encourage your school to apply for SunSmart status after this webinar? So we said we don't expect schools to have everything ready to go to apply, but I suppose there is support available, and I suppose just kind of maybe looking at the first steps to apply. So if people want to give their thoughts. Okay, positive feedback so far, which is good. Um, and as I said, we will be sending around all the slides from today's webinar, and again, further supports and information for people if they want to know more. I suppose we're trying to make it as easy as possible and support where we can. Okay, very likely super to get kids on board. Very likely looking forward to bringing it back. Might be a project idea for transition year. I think transition year is a really good year to do it. There's a lot of project ideas they can do, which is great. Thanks for your feedback. Now, the very last question is, what's the most important takeaway from today? So anything at all. As I said, there's no right or wrong answers for this. I hope you've learned something from our speakers today from Castellana Community College, Bernie Carter and Kelsey O'Donnell. So I know a lot of information was shared. So if there's anything you think is the most important takeaway from today. Anyone at all want to give any suggestion? Skin cancer is increasing. Yeah, I think a lot of people maybe aren't aware of that or realize that it's something that is on the increase and it'll continue to increase. Time outside, students out. Yeah, UV index. It's great. Okay. I'm just going to stop sharing this now. So thank you all for just engaging on that with us. So it's just good to get feedback from everyone. So we're hoping to finish early, so you're not going to be here for much longer, but we're just going to invite Kelsey and Bernie back and we'll just do some Q&A with both of them because I know some questions had come in as part of the registration. Um, so Kelsey, I might start with you. So one question that had come in is, what's the best way to respond when teens say things like "it won't happen to me" or I'll never burn"?
Um, I think it's really important to remember that teenagers, they're quite indifferent to the long-term health risks of a burn or thinking, oh, it'll never happen to me. So instead of focusing on the cancer that could happen in the future, which could be many decades down the line, it's more effective to highlight the immediate effects of UV damage. Um, so in for adolescents, we found that highlighting things such as premature skin aging, wrinkles, visible skin damage, is more important to them than something that's going to happen to them, a couple of decades down the line. So it's for teachers, it's really important to explain that skin damage can occur even when someone doesn't burn then as well, and that UVA radiation causes that DNA damage in the skin cells without any visible redness. So a useful message for students from teachers will be you don't have to burn to damage your skin, and that any tan is actually a sign that a tan is actually a sign that the skin has already been exposed to harmful UV radiation.
That's great. Thanks, Kelsey. I think sometimes, yeah, focusing on the short-term side effects can draw their attention, but obviously highlighting the long-term effects as well is important. But yeah, sometimes they don't think about long-term into the future. So thanks for that. Bernie, I might come to you next. So
Yep.
is there a wait time to book for the Marie Keating Foundation to present in schools?
Yeah, we would ideally like a 3 week lead-in time, and that's just to make sure that we have a nurse available, to come to the school, because our nurses do present in the community and go out in our mobile units as well. So just so we can guarantee a service, we'd highly recommend give us about 3 weeks notice.
Okay, perfect. And I said we'll
Yeah,
be sending around a link to where you can book and more information following today's webinar with the recording anyway for people.
yeah.
Then Kelsey, I might come back to you. So another question is some teens believe some beds give a base tan that protects them. So how do we challenge that myth with students and young people?
I think this is a really common myth, and it's important to know that scientifically that a base tan will give you protection isn't true. So a tan only provides a very small amount of protection, and it's usually equivalent to an SPF protection of 2 or 3, which is never enough to meaningfully protect the skin from UV radiation. So it's important for them to know what is happening when they are tanning, that it is causing, again, that DNA damage that's being caused by UV exposure, which is causing more of a pigment. So it's important to get across to the students and the younger people that a tan is a sign that the skin has already been damaged. And this in area of sunbeds are particularly concerning because it exposing the skin to UV radiation that isn't moderated, and especially if they're starting at a very young age, this significantly increases their risk of melanoma as well.
Thanks, Kelsey. Bernie, then is there any particular myths or misconceptions about skin cancer that you find teenagers commonly believe when you do go out to schools and present?
Do you know, I think this could be a webinar on its own, the whole
Very
myths,
true. Yeah.
because it's a huge one. And like Kelsey said there's a big thing we would hear from the students, primarily the girls, that a base tan may prevent sunburn. And we'd often hear added on to that, that a tan is pretty. So really trying to encourage the students to embrace their natural skin color is very, very important. A big thing we hear as well, sunbeds are safer than sunbathing, which we know is absolutely not true. And I think we've had lots of slides and presentation on that today, on the huge danger of sunbeds. Another one we hear as well is I don't need to apply sunscreen. Sure, it's rainy, and especially where I come from, Connemara, where it never stops raining. But of course, we know that's not true as well. And educating the children that it's not the heat of the sun that damages their skin. It's the ultraviolet rays, as Kelsey
Hmm.
presented, we don't feel, we don't see. And really, I would say, and we would say, look, our skin doesn't hibernate. Protect your skin all year round. And,
Yeah.
a big one we get as well is young people would say, well, young people don't get skin cancer. That's for oldies, often like you, they would say. And that's lovely. We can have a laugh and a giggle about that. But of course, skin damage starts from a very young age. And we would really encourage to educate the children about protecting their skin from a very young age, to really take on responsibility themselves and bring in their sunscreen, not to be relying on teachers and parents. And really, I think that is number one, like getting them
Hmm.
educated from a young age. And yeah, there's so many,
Yeah.
sunscreens are dangerous, the chemicals, and my vitamin D, like, I need my son to get there's just so many out there. It's really nice idea to have a poster up in the schools about, some of the most common myths, and a few little answers beside it, and maybe getting the students to do that, I think it might be a suggestion.
Yeah, that's a great idea. That's a great
Yeah,
project idea. And I suppose we have a lot of videos with dermatologists kind of highlighting those common myths that all the ones you've
yeah.
mentioned we've recorded and they're short, less than a minute long. So they might be useful for teachers as well to kind of share those with students. So Kelsey, just one last question. So what signs should teacher look out for that might suggest a student is using sunbeds?
So this is an area where teachers would need to approach quite with a lot of sensitivity
Hmm.
and without making any assumptions that a student is using a sunbed. Um, but possible signs of using would be a very deep or a sudden tan, particularly during the winter months. Um, and noticeable tan lines that would be suggestive of artificial tanning, especially around the face where you would see the goggle lines.
Hmm.
Um, and I don't know if anyone is aware of a sunbed tan. It's a different color. It's a very deep hue. It's almost like a reddy purple type hue. So it's a very, very deep type color. And especially and other some people can go quite red as well. So it's noticing that. And then it's if teachers are concerned, the most helpful approach would be to create an open discussion with their student and talk about sun safety rather than confronting the student directly. And then just having discussions and conversations about the UV risks and the dangers of it. And trying to get them into making more safer choices rather than a confrontational um,
Hmm.
discussion with them.
Yeah, that's great. I know we've got queries in NCSP just from teachers maybe concerned about students potentially using them and do we have any resources and supports available? So we would often share kind of videos and leaflets and posters we've created kind of to highlight and that they are illegal for anyone under the age of 18 as well. And I know Bernie probably the same when you're going out with the
Yeah.
Skills Cancer Awareness Program and cover sunbeds as well. But I think it's definitely a important topic area to cover and just to highlight that. Bernie,
Yeah.
then just one last question. So are there any specific messages that resonate better with boys versus girls or with different age groups when you do go out and talking about,
Yeah.
say, the area of skin cancer and sunbeds?
But one thing I'd just like to come back to there, and I know yesterday our mobile unit was very near a school. It was at a shopping centre, it wasn't at a school. And a young girl came on board. I think she was about 16, looking for after sun because she got such a bad burn from the sunbed. And she actually, talk about myths, was of the belief that the after sun would undo the damage already done to her skin. So I think that is something as well to highlight to the kids that,
Mm,
the after sun doesn't do that. It's not going to undo the damage, but to have the open conversation and work with them because in the line of specific messaging that may resonate with the boys versus the girls, a big one we find is targeting messaging for young girls to have it more often around the impact on their skin as far as premature aging is concerned, wrinkles, sunspot, because this is often, I know from having three daughters myself, this is often more a concern because again, it is hard to convince a young person that they may be at risk of skin cancer. But yeah, young girls do not like the aging, and especially as we know the huge negative impact of social media on young girls to look a certain way and to have that perfect skin. And often they see the suntan as giving them that perfect looking skin. So yeah, we target our messaging around skin cancer prevention, but we do talk about, the UVA, aging the skin and how to protect their skin from aging. And often that is the way in with the young girls. With boys, and I know this from presenting of one boy and three girls, but also presenting around the world and running a skin cancer campaign in Melbourne, directly looking at, messaging addressing younger men and younger boys. What we focused on was a messaging that addressed their tendency to underestimate the danger of the sun and really focusing on convenience. Boys are less likely to apply sunscreen and more likely to wear the hats, maybe
mhm.
more likely to wear the sunglasses as well. So really looking at that, kind of looking at the gear, of course, focusing on the sunscreen. And really, for both, there's no safe level of sunbed use or exposure to UVA, UVB. Really, the 5S is very, very important. And boys often need to be targeted on convenience, as in the easy to apply sprays. And I saw that with my own young guy as well, running out to the pitch, going on to sports, something to get on them, get it on them fast. While the girls, again, were more likely to respond to vanity related health messaging.
Okay, that's great. Thanks, Bernie, for all that feedback. So I suppose that's all the questions from today, and I just like to thank everyone for joining the webinar. So as mentioned, we will be sending around the recording and links. So we'll send out that tomorrow. And if you do want to send that on to other colleagues, you can do so. So thanks everyone for your time this afternoon. And yeah, thank you.
Thank you.
Thank you.